right now we're going to demonstrate how to do an accurate manual muscle test. So that's how you can test a patient's strength. And that's really important in critical illness just because there's so much weakness with the critical illness myopathies and neuropathies that you often see with patients who have been critically ill. One thing to think about when you're looking at a patient's strength and movement is that if a patient has proximal weakness, that usually tends to be more of a myopathy, so an issue with the muscle. Where if people have distal issues, coordination and sensation, those usually tend to be more of a neuropathy. But often with the critically ill patients, there's a combination where they have both myopathies and neuropathies. So it's really important to look closely at their strength. I'm going to demonstrate upper extremity strengthening, and then Maryanne will show you lower extremity strength testing. Though if I was treating this patient, I would look at their strength in their arms and their legs, and Maryanne would also look at their arms and legs. So therapy likes to look at patients very holistically. We don't typically isolate upper extremities and lower extremities based on discipline. So the main thing to think about when you're doing a manual muscle test is to score a 3, so it's a range, 1 to 5. To score a 3, they have to be able to do full range of motion against gravity. So when you're looking at shoulder flexion, you want to make sure they can do the full motion all the way against gravity. So can you raise this arm up all the way up over your head, up, 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 so he can fight gravity all the way up, so you know he's at least a 3. And then I'm going to drop you down, and then can you hold your arm here? Don't let me push you down. So hold, hold. So with that resistance, that's going to put him up to a 4 or a 5. When you're looking at the elbow, for elbow flexion, they again want to fight gravity. So can you bend your elbow up? Good. And then come down, hold it there, hold, hold, hold. So a little resistance. Good. To look at elbow extension, you can't just have your patient here, because as they go into elbow extension, gravity is going to be helping them get there. So to truly test your triceps, you've got to come into a gravity, against gravity position, which is here. Now see if you could lift your hand up off your head, up, 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 up. So you made it all the way, full range of motion against gravity. Great. And then bend down and hold right there, and don't let me push you down. So now he's taking some resistance. If he wasn't able to get full against gravity motion in bicep or tricep, I can bring him into a gravity eliminated position, which is here. So just relax into my hands. Can you bring your hand to your mouth? Good. And then out towards me, push, push, push. So if he can do full range of motion in this gravity assisted position, then he scores a solid 2, okay? And then with wrist extension, you want to come up with your wrist, so that's a 3 at least. Hold it there, hold, hold, good. For gravity eliminated at the wrist, I turn him here, and then see if you can bring your wrist up and down. Okay, so that's a 2, good. And then for fingers, you want to make a full fist, good, that's a 3. All the way extended, good. Can you hold your fingers there? Hold, hold, good. Testing for true strength in the hand, there's more specific measurements we can do. We have grip and pinch measurements if we wanted specific pound strength. But I often have patients just squeeze my fingers, give me a good squeeze, good. You can relax this one down. If they're having weakness in their hand, you can anticipate that they're going to have some problems with their fine motor, some of the self-care activities, and that's when I might consider doing modifications like cylindrical foam to help with grip and coordination. There's also other modifications that we can do with that.
I'm going to look at hip flexion first. So go ahead and lift your knee as high as you can. And if he can get all the way up there, that's a 3. A lot of times, especially older people, are only going to get to about here, maybe even a little higher. That can't be more than a 2+ if they don't get all the way up. So if he brings it all the way up, he shows me he's got a 3. I'm going to have him bring it down about halfway. Hold there, hold, hold. Now I'm going to get him a lot of resistance if he's going to give me a 5. Knee extension, I'm going to have him kick his leg out as far as you can. Now, a lot of times, again, the hamstring will be tight, and so they may not get all the way. And so I may need to look at that in a little different way to get a true idea if that's hamstring or strength. Go ahead and bend your knee a little bit and hold strong, hold, 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 hold. Good. Okay, then feet flat on the floor. Have you lift your toes up. Again, range of motion is a factor here. So a lot of times I'll get under and see if he's at his end range or if I have more that I can get passively. And then hold there, hold strong, 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 strong. And I'm pushing through his foot, not just his toes. I can also do great toe extension in this position as well, which is sometimes a nice one if we're concerned about peripheral nerve issues. To do a true hamstring knee flexion, they need to be standing and flex up against gravity. And to do plantar flexion is actually extremely hard because plantar flexion, to get a 5, you need to be able to do toe raises 10 times on one foot only. So generally I may comment, like when we're doing toe walking, more of a functional standpoint. And then if we suspect that there is some sort of critical illness, neuropathy or myopathy, that's when we'll probably ask you to consult rehab medicine to help sift through that and to help us figure out kind of where the patient goes and how to help their long-term recovery. Really the only treatment, the only evidence-based treatment for critical illness weakness is early mobility, and that helps both prevent it and delirium.